Thank you so much for your time. Good morning.
Good morning. Yes, I'm Dr. Eglay Nyakoa, as you mentioned, and I'm an IVF consultant at Fertility Point in Nairobi.
Thank you so much for your time this morning. It's a very important conversation because, things have progressed quite a bit, and there are women who don't want to get married. There are women who are married but want to look at other ways to receive or to get children. There are women in same-sex relationships who still want to have children together, and these have been great ways to consider fertility for those who are exploring different methods. So let's speak about this. Maybe you could give us a broader explanation on what donor fertility is, or this donor sperm reproductive process looks like.
All right. So, just in simple terms, sperm donation is a process where a man, that is the donor, provides his sperm to help an individual or a couple to conceive a child. And the process, the donated sperm, can be used in fertility treatments like intrauterine insemination. This is where washed sperm is prepared and placed directly into a woman's uterus after ovulation induction treatment, or in IVF, that is in vitro fertilization, where the eggs are retrieved from the woman, they are fertilized with the donor sperm in the lab to create embryos, and then the embryos are transferred in the woman's uterus. So just to put it in context, a donor can be anonymous through a regulated sperm bank, or can be a non-donor, whereby you can bring in a family member or a friend. But here it's crucial that we have a very legal agreements in place for non-donation.
There are two sides to this conversation, doctor, and this is the side of the sperm donor, and then there's the side of the recipient of the sperm. So I want us to separate these conversations. Let's start on the side of the sperm donor. Who can be a sperm donor? What are the requirements for someone to be a sperm donor?
All right, so for the requirements for a sperm donor, first, there's an age requirement, whereby it depends, but the donor can be anything from 21 years to less than 40 years. Although in Kenya now we are having our assisted reproductive technology bill, which is stating that the donor should be between 21 years of age and 35 years old. And also, there we have to do some screening, which is very rigorous, and first health and genetic screening. So for this, we have to do comprehensive medical and family history, which is taken to just understand the background of this donor. Also, we can do some genetic carrier screening tests for hundreds of inherited conditions like cystic fibrosis, sickle cell, and others. And also, we screen for infectious diseases like HIV, hepatitis B and C, syphilis, etc. So also we also check for the sperm quality, because if it's a sperm donor, then you can choose. So we have to ensure that the semen analysis is assessed, and we look for the count, the motility, and the morphology. So all these have to be optimum before we select the donor. So typically it's age, health and genetic screening, and also the semen analysis has to be optimum.
Okay, I'm glad that you said these, because I guess there would be an assumption from many people to think, yeah, as long as you're a man, you can donate sperm. But there is actually a process that is to take place. There are tests that have to run, and are there, in fact, let me ask you, are there sperm that can be rejected from being donated?
Yes, especially, so before we do the semen analysis, we do the health screen first. That is, first there's the age. Mostly less than 40, because even men above 40, there's an issue with quality of the sperm. And then also there's an aspect of the semen analysis. So when we do the semen analysis, the sperm count has to be okay, the morphology, the motility, they all have to be fine. So you can go donate But then if your semen analysis is not good, then you will not be selected as a sperm donor.
Okay, and what happens to the sperm once it's donated?
Okay, so once the sperm is donated, then it has to be prepared, that is to be washed. There's a sperm wash procedure that is done. So there's an analysis first, and then there's the sperm wash. And then once the sperm is washed, then it's cryopreserved. It's frozen and then cryopreserved in the IVF laboratory. And then it's quarantined. It takes around 6 months before we can use the donated sperm, because we have to repeat the infectious disease screening, like HIV, because of the window period. So that's just to confirm that this sperm is actually okay for the health of the recipient and the baby if they conceive.
Okay, so that is the end of that particular process on the sperm donor side. Then comes the beginning of a new process, the process of those who need the sperm for their own conception. Let's start there. Who are the most common people or reasons for women and couples to choose sperm donation?
Okay, so top on the list, I would say single women. Single women who want to undertake this path of motherhood and they do not have a partner, then they can come to the clinic and they benefit from donated sperm for their conception, either for IUI or IVF. Another major group that we use sperm donor for is the people having male factor infertility.
Okay.
And in this case, it's a couple, it's a male and female, and they're requiring to do treatment. And we have either there's very low sperm count, or there's poor sperm motility, or there's complete absence of sperm, which is called azoospermia. So in this case, then some of them opt to use a sperm donor, and this is very common because factors causing infertility, male factor is actually 50%, female factor 50%. So we get a lot of this. Another thing that another requirement is some men with genetic disorders so they know they are carriers for a significant genetic disorder, so they do not want to pass this to their children, so they opt for sperm donor. And also minority group that we are using sperm donor on is same-sex female couples who want to conceive, want to have a baby, then they can use a sperm donor. So these are the categories of people that
All right, let's take a break, Dr. Nyakoa. I want us to come back and speak about the process itself, whether or not this way of conception can be, less likely to be successful than natural conception or not. And of course, the processes that those who are using a sperm donor conception, processes that they need to follow. So stay on the line with us. We're speaking about sperm donor conception in this hour of the show. And if you have your own things to say, and if you want to contribute to this conversation, you can go to our live stream on Facebook and on YouTube and comment over there.
Ulimwengu unatazama Johannesburg. Viongozi kutoka nchi zenye uchumi mkubwa zaidi duniani watakusanyika ili kufanya mazungumzo ambayo yanaongoza mataifa, masoko na mustakabali wa mataifa. Tayari unajua kwamba Channel Africa itakuwa pale pale ikikuletea mijadala, maarifa na uchambuzi ambao ni muhimu. Kongamano la G20 kuanzia tarehe 22 na 23 Novemba, mubashara kwa mtazamo wa Kiafrika. Endelea kusikiliza Channel Africa, mtazamo wa Kiafrika.
#on the move and connect with us.
Dr. Eglay Nyakoa is joining us on the line, fertility specialist, who's helping us unpack the concepts, the conversations, but also the processes of sperm donor conception. We have spoken a little bit about the people who would be more likely to want to take on this path of conception versus natural conception. But let's speak about the process itself. I'm sure it's quite extensive for those who are seeking a sperm donor. The first thing that people think about? I mean, if you think about conception, people want to, have children that are like themselves, who maybe are the same race or a particular race, who are so tall, or maybe they come from like smart genes. I don't know if that is a thing. Is that part of the process at all? Are people able to choose the donor that may have similarities to who they are so that their child can be similar to them?
Yes, that is part of the process. So when we get the donor, we keep a profile of the donor, including the physical appearance, the height, the weight, the skin complexion, the tribe, for example. Yeah. So when someone wants a donor, then they select from the profile of the donor.
Okay.
So they're able to select whatever is similar to them or whatever they like.
All right. And the process itself, are there people who cannot be, viable for sperm donation? So what are the health checks that happen for the recipients on the other side?
All right. So the recipients on the other side are people who have come with issues of conception. As I've mentioned, we have single women, we have people with male factor infertility, we have same-sex couples. So these people, there's no contraindication to them using a sperm donor. So it depends on what is their condition and what treatment we are doing. So we do not have a contraindication for recipient in receiving the sperm donor.
I see. And what then becomes the process of this sperm actually being fully donated and the conception process? You mentioned two different kinds of conception processes. So perhaps you can give us just a brief rundown of both of them, the IUI process and the IVF process.
All right. So, yes. So the IUI process is whereby for the woman, for the recipient of the sperm, after she has selected, so then we do a treatment called ovulation induction, where we give some medication to stimulate the ovaries to produce 1 or 2 eggs. Then we will we'll check with the ultrasound to see if the eggs are ready. Once the eggs are ready, then we are able to give a trigger injection and then schedule for the IUI process, which is intrauterine insemination. So this process is done where the sperm is washed and then placed inside the uterus and left there. So the rest of it becomes natural, where the sperm has to swim, get to the get to the fallopian tube and fertilize the egg. So for IUI, for the recipient, the fallopian tubes have to be open. That's a condition that has to be met. Now for IVF, this is where fertilization is occurring outside the body. So here we stimulate the woman, the recipient of the donated sperm. We stimulate her ovaries to produce many eggs, and we do a retrieval of these eggs. And then on the same day we do the retrieval is when we use now the sperm for fertilization. We create an embryo, and then we will return these embryos to the woman's uterus. So we do an embryo transfer of 2 or 3 embryos. So that is the process so it depends with what the condition is for the recipient, whether we are doing IVF or we are doing IUI, depending with their diagnosis.
How successful is conception using the donor sperm compared to natural conception?
All right, very important. So for example, if it's a single woman, of course, they did not have any sperm. But if we are treating male factor infertility, where we had issues with the sperm, whether the count or the motility or morphology, then definitely the success is going to be higher with the sperm donor, because I had mentioned that for the sperm donor selection, we have to ensure we do a semen analysis and then we select the sperm that is good, is optimum. So that increases chances very high, very much. So if we are doing IUI, the success can be about 20 to 30% success rate. And for IVF with donor sperm, then success is quite higher, and we can have up to 50% live birth rate with donor sperm. Yeah.
I think maybe this might be, I don't know if it's a frequently asked question, but on both ends, from the sperm donor to the recipient, is there pain involved, especially with the recipient in the IUI and IVF processes? Is this an invasive surgery that they have to go through, or something maybe less invasive?
So for IUI is less invasive because we are just preparing the sperm, and then we are introducing this sperm into the woman's uterus through the cervix, through the cervical opening. So we are not cutting anywhere, we are not pricking, so it's not painful. For IVF, we need to retrieve the eggs outside the body. So the egg retrieval procedure is done under sedation. So the woman is put to sleep so that this retrieval is done. It's still done transvaginally, but it's not an open surgery to remove the eggs. So it's just sedation, and then the retrieval is done.
Okay, so also not invasive. There's no cutting involved. There is no really open surgery that's involved in that process.
No open surgery involved.
Okay, but I want us to look at the other side of this conversation. I know it's very medical, but these are very emotional processes that people are going through, wanting to conceive a child and having to go through, medical interventions to conceive a child comes with a lot of emotions. How does the option of sperm donation empower women and couples who come in for this process in making their reproductive choices?
All right, very important. So one thing that this allows for women, especially single women, is it gives them reproductive autonomy, because it's allowing them to pursue motherhood on their own terms and timeline, so independent of a male partner. Yes. So they're in full control of the decision and the process. So that's one thing that it's giving them reproductive autonomy. And then it helps to build a family for all. How do I put this? It allows everyone who wants to conceive or build a family a chance, including single women, same-sex couples, and this affirming their desire to be a parent, which is not limited by relationship status. Yeah.
Absolutely.
And also, women now are able to make informed choice, because sperm banks will provide them with donor profiles, and they are able to make a decision and select a desirable sperm donor that they want. And another thing, I think it's also helping to break stigma. I don't know if that is very common in South Africa. If a woman is single, no child, there's a bit of stigma with that. Yeah. But now if a woman is able to just conceive and have her own children so that really helps break the stigma of not having a child.
Yeah. Well, we'll leave it there. Thank you so much for your insights, Dr. Eglay Nyakoa. It has been a pleasure to speak to you today, and I hope very educational to those who have been thinking about these options, but also to those who haven't, and just informing themselves of the options that are out there. Thank you so much for your time.
Thank you very much for having me.
That is Dr. Eglay Nyakoa, Fertility Specialist at Fertility Point, speaking to us about sperm donor conception as a part of reproductive health. And that is in our Live Well feature today. It's almost 11:30 Central Africa time. As we move on, let's get once again our latest sports news.
Sports on Channel Africa.